Your Excellency, Dr. Goodluck Jonathan, President of the Federal Republic of Nigeria, Your Excellency, Mr. Haile Mariam Desalegn, Prime Minister of the Federal Democratic Republic of Ethiopia and Chairperson of the African Union, Your Excellencies, Heads of State and Government, Heads of Delegation, Dr. Babatunde Osutiam, Under-Secretary and Executive Director of the United Nations Population Fund, Executive Director of UNAIDS, Dr. Michel Sidibe, Honorable Ministers, Heads of AU and UN organs, members of the PRC, distinguished guests, ladies and gentlemen, I'm honored and privileged to join in welcoming you to this special summit on HIV and AIDS, TB and malaria, taking place in this beautiful city of Abuja. I wish to sincerely express my personal appreciation and that of the African Union Commission to the President of the Federal Republic of Nigeria, His Excellency Dr. Goodluck Jonathan, not only for hosting this important event, TB and malaria have been held here in Abuja in year 2000, 2001 and 2006, and decisive commitments were undertaken by our leaders, including scaling up and accelerating universal access to prevention, treatment, care and support for HIV and AIDS, TB and malaria services by 2015. We now need to scale up the implementation of these commitments. Excellencies, significant progress has been made by member states towards universal access to health services in general and HIV and AIDS, TB and malaria in particular. The annual number of people newly infected with HIV in Africa has fallen by 25% since 2001. And the number of people who died of AIDS-related causes in 2011 was 32% lower than in 2005. We therefore need to step up actions to ensure that there are no new infections, HIV infections. Since 2001, nearly 13 million people in Africa have been reached with TB treatment. There are also encouraging signs in the efforts to prevent new cases of malaria. The burden of malaria in Africa is down by 1/3, and 8 countries have already achieved the targeted reduction of 75% in malaria incidence since 2000. There is no doubt that our leaders' commitments and the support of our international partners have paid off. In this regard, the AU Roadmap on Shared Responsibility and the Global Solidarity of July 2012 has the potential to enable us to control and eliminate these diseases if well implemented. Excellencies, even though we are making progress, Africa still remains off track in reaching the MDG target of halting and reversing the global TB epidemic by 2015, and is the only continent not on track to achieve a 50% reduction in TB mortality. For malaria, Africa remains the continent most heavily affected, with severe effects on maternal and child health. Even though malaria is cheaply preventable and curable in Africa, it continues to kill. On average, a child every 30 seconds, and this is totally unacceptable. Excellencies, one of the greatest challenges we need to address is the dependency of many national responses to AIDS, TB, and malaria on external financing and foreign-produced medicines. In the case of HIV, for an example, over 60% of continental investment is mobilized externally, and over 80% of treatment is imported. We therefore need to accelerate the implementation of the earlier Abuja commitments of stepping up the mobilization of domestic resources and strategies for innovative financing to strengthen the health systems. Access to health is a fundamental human right for all and should include community access to nutrition, to information and systems to promote good health, in addition to comprehensive and affordable basic health services. Today, we have the unprecedented opportunity to lay the foundations for ending the HIV/AIDS, malaria, and TB epidemics in Africa. In the context of the post-2015 development agenda, the new AUC Strategic Plan 2014-2017 and the African Union Agenda 2063, efforts to accelerate and sustain progress in the response to HIV, AIDS, TB, and malaria should be people-centered, grounded in human rights, gender equality, global solidarity, mutual accountability, and solidarity with vulnerable and marginalized groups. We must embrace proven and cost-effective measures, including micronutrients, supplementation, insecticide treatment, mosquito nets, and for those countries who deem fit, DDT, breastfeeding, and intervention to improve basic health care. There is also need to sustain information campaign on HIV/AIDS prevention and treatment, and help increase young people's access to youth-friendly, gender-sensitive health services that provide voluntary testing and counseling. Of course, nutrition is of paramount importance because malnutrition, as in any case with many other diseases, would impair the immune system of the victim, of the patient, thereby exacerbating the health condition. In addition to this, it is to be highlighted that the treatment also requires healthy, good, and sufficient nutrition to minimize the side effects. Special efforts should also be made to provide necessary assistance to women when strategies are being developed to combat these challenges, in line with existing global and regional commitments on HIV and AIDS, TB, and malaria. This includes the implementation of the Harare Call to Action and the Abuja commitment to accelerating progress for women and girls communique, championed by the Global Power Women Network Africa, amongst others. Everyone knows that ending AIDS, TB, and malaria is not going to be easy, not going to be quick, and not going to be cheap. It is a huge investment. Like the investment in the eradication of smallpox, it is an investment that is absolutely guaranteed to bring enormous returns. Excellencies, before I conclude, let me reiterate the importance of research in contributing to eliminate HIV/AIDS infections, sexually transmitted infections, in line with the expression of the commitment of the second high-level meeting communique of Global Power Women Network Africa. I quote, "We are committed to promote safe, ethical, beneficial, gender-sensitive research that aims at addressing the vulnerabilities of women and girls to ending HIV/AIDS infections and sexually transmitted infections, amongst other diseases," close quote. I'm confident that this summit will further accelerate the continent's response and efforts towards eliminating these diseases by ensuring universal access to services, strengthening health systems, especially for the poor and the most marginalized people. Progress must be faster over the next few years. It is time for action and the final push. I thank you.